Hello and welcome to this beautiful day of training. We're going to do some warm-ups. So bring your feet together, your hands on your knees, and you're just bending the knees back and forward. We're not locking the knees out, and we're keeping the heels on the ground the whole time. So we're stretching out the ankle joints, getting the knees ready, getting the body prepared for some weight to go through the legs. As I'm doing this, as I start to straighten my knees, I'm pushing through my big toes. So I push my big toes into the ground like this, just a little bit. Then I let it off. I push them in, let it off. So a little bit of activation through that big toe. Flexor hallucis longus is the big toe muscle. It's a big muscle an important muscle to control rotation in the feet. So the pronation, supination of the foot. So as I get more warmed up here, this is probably the first thing you do in the day that's warming up your body, which is a very good thing to do. Get the joints ready for the day, release a lot of stagnation from the energy system, getting more information about your body, or from your body going to your brain, to your awareness. And we're letting any stiffness that come from sleeping last night, we're letting that disappear pretty quick. So the rest of the day is a lot easier. Otherwise, it takes a few hours for that stiffness to leave. So as I get a bit more warmed up here, I'm going a bit deeper. The main thing is that your heels still stay on the ground. And as you get more warmed up, and over the course of weeks, months and years, you find you can come down quite a bit. But the main thing is that you're keeping heels on the ground. When you have the heels on the ground, it makes the force go through the back of the legs more, and not so much in the knees. As soon as you go into the ball of the foot, doing this, a lot of pressure goes into the front of the knees, which is a good thing to train sometimes. But for a lot of people, when the body is conditioned, it's not the right thing to do at the start. So we want it to go through the back of the knees. About 20 knee bends is good, so there's probably about 20 there. Then we start to circle. Just small circles to begin with. We're keeping the feet on the ground, flat on the ground. So I don't want to make the circle so big that my feet peel off the ground like this. It's not that. That's too much movement. It's too much abnormal force going through the knees and the ankles and the feet joints. And I'm feeling into my body. How's my body feel today? Does it feel a bit stiffer than usual? No energy today? Or do we feel really vital today? And if you let your lower back be straight like this, which is fine to do, you'll find that the pressure goes, that the circle stays in the knees. But if I let my lower back round out a little bit, I can actually make these circles affect into my lower back too. I don't know if that come on the camera clearly enough, but I can loosen my back doing this too. So let's get the other way. About 10 each way is good. The legs have a rotational component to them. Whenever we walk, run, do Kung Fu, there's rotation going through the joints. There's a small amount of rotation that goes in the knee. Usually when people think about the knee, it's just the joint that does this, the hinge joint they call it. But it actually does a bit of this as well. That movement there is coming mainly from my knee. Next we'll come up, feet shoulder width, and we're circling the hips. So you imagine you can have your hands on your hips, or you can have your hands on your lower back. Some people it feels really nice and supportive to have their hands on the lower back, especially if you've got a bit of a sore back or stiff back. So imagine you're inside a cylinder and you have to clean the inside of the cylinder with your hips. So the head stays in the center and my body's just staying facing forward the whole time. So I'm not turning at all when I do this. It's just staying forward and the movement's coming from the hip joints themselves, where the femur and the acetabulum, or the joint in the hip where that's meeting. There's movement that has to come through the lower back too. There's movement going through my neck here too to keep my head stabilized. It's what's called the righting reflex. There's a lot of change happening in the upper neck joints as well. So always look after your body. Don't do things that are going to damage your body. Reckless things, doing things too quick where you can't feel. We want to feel into the body. So as I'm feeling into it now, I feel like I make the circle a bit bigger. And it's I'm able to make that circle bigger without going into sort of pushing it into more range. We don't need to do that with these type of exercises. These are power release exercises. They're letting go exercises. They're release. They're soft exercise. Go the other way, which means that I'm softening and relaxing my body from the inside, relaxing my muscles. So when I relax my muscle, if I was to force it here, I feel a stretch through here. Bit of pressure to go there, so that's pushing it with muscle. But if I just go, just let this relax here, let it release, look at that, extra range there already. I'm not forcing anything. I'm just asking that tissue to soften, and it gives me the range. And that's a big way that internal martial arts, of which Tai Chi is a part, opens the body. It's opening from inside to out. Okay, feet still shoulder width, bend the knees, bend the hips. So I have this position of sitting on a high horse, a skinny horse, spine vertical, hands on the hips so you can feel your hip bones. And I'm going to move from the dantian, so just below my belly button, through if it's skewered through my back. This is actually going to be the axis point just through here, through dantian, and Ming Men it's called in Kung Fu terms. So I'm rotating through here. So the first way to get that, if you're not very good at how to do that, a lot of people actually can't make that motion happen, which is fine. It's not something we normally do. So you imagine there's a square hula hoop around your hips to start with, and you identify the corner. So that corner, go that corner, we go the back corner, we go this back corner, front corner, back corner, back corner. So I'm doing that without shifting my weight. I'm not shifting my weight to do this. I actually have to identify the corners with the corners of my pelvis. So 2 front corners, 2 back corners, which are really your glute medius. Kind of the point where you get an injection, that point there. So identify the corners. And as you feel into this and get more used to it, the more you can relax your pelvis, relax all the muscles around the hips, the more this starts to flow. And then you can link them up so it starts making a circular motion. So I feel this now coming right through this point. That's the main axis point. But as you might see, my whole body's getting involved. I'm not trying to add things to my motion. It's just the way the pelvis is moving, the dynamics of the spine and the ribs becomes part of it. So if the body wants to move, let it move. This is lumbo-pelvic control. It's called control of your pelvis and your lower back. And let's get out of the way. So identify the corners the other way. So you might spend a couple of weeks just doing corners. That's totally fine. It's a long life. Eventually you'll get it. And then I'm going to start to link them up. Another way to think about this is to think about where your tailbone is, and imagine drawing a circle on the ground as if your tailbone had a laser coming out of it, and you're drawing a complete circle on the ground with your tailbone. So that's another way that this exercise is practiced, especially when people use this as a Qigong exercise. Getting the tailbone moving really well, connecting to the tailbone is really important in Qigong. It's important in power development. Okay, so we finish with 3 back and forward. Tuck the pelvis forward, back, forward, back, forward, back. Give the legs a bit of a shake. There's a bunch of kangaroos watching me here again. So I'm bending the knees, bending the hips, central axis through my spine as if there's a skewer going through the top of my head, out through my perineum, stuck into the ground. I can't do this. I can't go forward and back. I can't sag. I can't extend. Just have this central axis through the body. I'm aware of that. Then I start to turn on that axis. Letting my arms swing as if my arms are a bit of rubber, a loose bit of rubber, a bit of rope. The hands are weights, and the hands gently tapping into my body. And I'm feeling the pressure go into my legs, into my feet. So the whole of my feet are taking the weight right now. And slowing down.